Hey there, science fans. Today we're talking about a disease called Mpox. It's a viral disease, kind of like the flu, but with some unique characteristics.
Mpox is related to smallpox, which was a much more serious disease that we thankfully eradicated. Scientists first discovered Mpox in monkeys back in 1958, hence the original name Monkeypox. But don't be fooled by the name. While it can infect monkeys, it's found in other animals too, like rodents.
In 2022, the World Health Organization decided to rename monkeypox to Mpox. This was done to avoid any stigma and to make it clear that this virus can infect anyone, anywhere. Remember, Mpox is a serious public health concern, and understanding it is the first step in protecting ourselves and our communities. Let's learn more about how it spreads in the next section. So how exactly does Mpox go from one living being to another? Well, picture this. A person comes into contact with an infected animal, like a rodent. The virus can enter the body through a cut, scratch, or even by just touching the animal's bodily fluids. That's one way Mpox jumps from animals to humans.
Now, let's say a person has Mpox. They can spread it to another person through close contact. This could be through direct contact with the Mpox rash, touching contaminated materials like clothing or bedding, or even through respiratory droplets during prolonged face-to-face contact. It's important to remember that Mpox is not as easily spread as some other viruses like the flu. It requires close contact, and casual contact is unlikely to spread the virus. Stay tuned to learn more about the signs and symptoms of Mpox in the next section.
Now that we know how Mpox spreads, let's talk about what happens if you actually get infected. After being exposed to the virus, it might take a while for any symptoms to show up. This is called the incubation period, and for Mpox, it can last anywhere from 5 to 21 days. That means you might not feel sick right away, even if you've been infected.
When symptoms do appear, they often start with a fever, headache, muscle aches, back pain, and exhaustion. These flu-like symptoms can last for a few days.
The telltale sign of Mpox is a rash that typically appears on the face, arms, legs, hands, feet, or even inside the mouth. This rash goes through different stages. It starts as flat, red spots that turn into raised bumps. These bumps then fill with fluid and eventually crust over and fall off. The entire process can take 2 to 4 weeks. Understanding these symptoms is crucial for early detection and treatment. The good news is that for most people, Mpox is a mild illness. They recover fully within a few weeks without any lasting problems. Their immune system is able to fight off the virus, and they get better on their own.
However, some people are at risk of developing more severe illness. This includes young children, pregnant women, and people with weakened immune systems. For these individuals, Mpox can be much more serious and even life-threatening.
It's crucial to remember that even though most cases are mild, Mpox should be taken seriously, especially for those who are more vulnerable. Early detection, seeking medical attention, and taking preventive measures are vital.
Just like with many other infectious diseases, there are steps we can take to protect ourselves and others from Mpox. One of the most effective ways is to avoid contact with animals that could carry the virus, especially rodents in areas where Mpox is known to occur.
If you do need to be around these animals, wearing protective gear like gloves and masks can help reduce the risk of infection. Good hygiene practices are also essential. This includes washing your hands frequently with soap and water, especially after being in contact with animals or potentially contaminated materials.
Another important preventive measure is vaccination. While there isn't a vaccine specifically for Mpox, the smallpox vaccine can provide some protection against Mpox. Vaccination is typically recommended for people who are at higher risk of exposure, like healthcare workers or researchers who work with the virus.
If you think you might have been exposed to Mpox or are experiencing symptoms, it's important to seek medical attention right away. A healthcare professional can assess your symptoms, determine if you need to be tested for Mpox, and advise you on the best course of action.
While there is no specific treatment for Mpox, there are things that can be done to relieve symptoms and support the body's natural healing process. This includes getting plenty of rest, staying hydrated, and taking over-the-counter medications to reduce fever and pain.
In some cases, antiviral medications might be prescribed, especially for people with severe illness, or those who are at risk of developing complications. Remember, early detection and seeking medical care are crucial for managing Mpox and preventing its spread.
You can support us on the given PayPal ID, JED7YZ6B8ANJ, so that we can provide you more good information.